Hey guys, so I just wanted to do a bit of an update with my health. So this is going to be a health update plus a little bit of a bariatric update, but I'll also talk about how my rheumatoid arthritis and fibromyalgia has been affected by the bariatric surgery. And spoiler, it's for the good, so that's great. So the first thing let's talk about is how has my health changed with the bariatric surgery. So at this point, with about a 55, 60 pound weight loss, I have seen a lot less inflammation in my body. Now, weight loss and having this surgery is not going to cure me of rheumatoid arthritis or fibromyalgia. I was diagnosed with both of these conditions before I was so severely overweight. So it was never a weight issue that had caused these, but the weight definitely made it a lot worse. So the rapid weight loss that I have experienced, in addition to the restrictions to my diet that were caused by, either going through the different phases of the the diet, the liquid, and giving my system a rest from processed foods, from food in general, doing the liquid diet and the pureed and the soft food and things like that. And then also, with this surgery, having a very limited amount of sugar that I can intake because it makes me feel sick if I have too much sugar or too much sodium or too much of many processed things, because I have to eat a lot cleaner diet just to combat like nausea and dumping syndrome and things like that. That dietary change, which I had a pretty low sugar diet in the first place, but now it's extremely low sugar diet, in addition to even lower sodium and things like that than I had before. And just with the small portions and giving my digestive system and my system in general a rest, I have experienced a lot less inflammation. For the first, I'd say 3 months, just about, I wasn't experiencing any morning stiffness from the rheumatoid arthritis, and my pain was extremely under control. I was taking half the amount of painkillers that I would normally take. The Rinvoq that I take was completely handling my symptoms. I wasn't feeling any new additional pain. I wasn't having any swelling of my hands or feet. It was great. I still had rheumatoid arthritis symptoms, definitely, but just not the things that are more severe that were taking the most out of me. Now that it is December and it is winter, I am having some of the morning stiffness back and a little bit of like the pain in my joints back, just kind of one of the things that come with the colder weather. But some of this feeling and stiffness and inflammation that has returned might be in addition to some of the other health issues that I have been dealing with. But otherwise, overall, my rheumatologist was very happy with my blood work, very happy with the lack of inflammation, very happy with my lack of stiffness. And we're just hoping that, with the Rinvoq and the little bit of pain management that I'm doing, which is, nightly muscle relaxers and Lyrica only at night now, that I will be able to keep the rheumatoid arthritis completely under control and live as normal of a life as possible for as long as possible. So that is the goal, and hopefully it'll stay that way and I can become more active. Like I talked about in my past videos, I am a lot more active, being able to walk, being able to stretch and do yoga at home, being able to do some resistance training with resistance bands at home as well. I have a little pedaler, just like something where you sit down and you can pedal and it has resistance that I'm able to use. That's very helpful. And I'm taking my dog on 4 to 5 30-minute walks a day, which is great. On the weekends, I can do even longer. So I'm really enjoying being able to build up that stamina and just be a bit more active. That does not mean that I don't have bad days still, where I feel extremely exhausted, very run down and tired, and just I could tell that my system is having a hard time. That's still there. I do still deal with a lot of the fibromyalgia trigger point pain. It's not as severe as it was before, but it's still there. So even just things as simple as sitting down, sitting on the couch, sitting in my recliner that I sit in for work, anything like that still like can be pretty painful for me. So between a recliner that I sit in for work, between using a yoga ball that I sit on for work, between standing with my standing desk, just doing as much as I can to continually move around is helpful. And now that there isn't as much weight on my body and on my joints, it's a lot easier to move around and get moving. So also, in addition to that, I've been able to cook a lot more of my meals. I can stand a bit longer, so I could cook in the kitchen a lot more. One of the things that held me back from cooking as often before was just the fact that it was really hard to stand for a long period of time. A lot of back pain, a lot of joint pain when I was doing that. The only thing I haven't noticed a big difference in since the weight loss is my back pain. Now, I have had a back injury since I was in my early 20s. And so that was around even when I was the fittest I've ever been in my life. So I think kind of like the years that have passed and just the damage to the degenerative discs and nerve damage that have happened in my back, in addition to having osteoarthritis in my lower back, that kind of is what it is. And the pain is manageable for me. It's always been, well, not always, but after I got facet block injections and things like that for a few years, the pain became very manageable. So it is manageable, but that I haven't really noticed as much of pain relief in. And maybe with additional weight loss, I will have more pain relief. I have noticed that it's a little bit harder to lose weight as rapidly 4 months into the weight loss journey. I'm going to have to be a lot more diligent with tracking my food and my calories, because as time passes and as my stomach heals, you're able to eat a lot more foods and eat a lot more volume. So you have to be a little bit more careful with weighing out how much you're exercising with how much you're eating. So I am using the Bariatric app now to track my meals and just make sure that I'm reaching the correct amount of protein and keeping my calories reasonable so that the weight loss can still continue at a steady rate. But I have noticed a bit of a slowdown, which would normally be around about me getting close to the time to be able to stop taking the Ursidol or Actigol, which is the gallbladder medication that my team prescribed for all of their bariatric patients to start taking. And we're supposed to continue to take that until we're no longer losing 10 pounds per month. So let's talk about the other big health update that I need to talk about that has to do with the gallbladder. So I think I mentioned in my past video that I was having some issues with my gallbladder. I was having some lab work that was showing both liver and gallbladder issues and inflammation. And so my doctor did decide to refer me to a GI specialist, who decided to have me do a CT scan and a HIDA scan. And the CT scan showed an enlarged liver and an inflamed and enlarged gallbladder, although they couldn't see any stones. And so they did a HIDA scan, which I don't know if anyone's ever had that done, but I did take a little footage of what that was like. So I'll go ahead and insert little bits of the video here. But basically they inject you with radioactive saline, and then they watch that saline go through your liver and into your gallbladder. And that's about a hour to 2 hour process of you laying under a machine that reads that radioactivity. Now it's not an x-ray machine. I'll put somewhere up here what the machine is called, I forget, but it's an interesting machine. I think they sometimes do gastric emptying studies with this as well. But you have to, the hardest part about it was laying still for 2 hours. It was very painful, especially with the back issues that I have and just having stiff joints. When it was time to get up off that table, I could barely move. One of the worst things for me with my arthritis and fibromyalgia is to have to be completely still for long periods of time. It causes severe stiffness for me. So I was definitely limping and barely able to move or walk once I got up off the table. And even probably only about 30 minutes into the process, I couldn't sit still any longer. I had to keep fidgeting and moving around because it was just really painful. Even though they did, prop me up, prop up my arms and prop up my knees and do as much as they could to make me comfortable, you have to stay in a very specific position so that it could read. looking at everything, all the connections from your liver to your gallbladder and everything like that. So after that 2 hours of having the system, or having the imaging of your liver and your gallbladder, they then take you to a separate room where there's like a recliner, and you already have an IV that you had for the radioactive saline that they inject. And then they connect you to an IV that slowly pushes through a medication that causes your gallbladder to empty. And so that's how they look at like the percentage of how well your gallbladder is emptying. And then they do another scan, about a really short one, like a 30-minute scan after that, to see how much of your gallbladder has emptied within an hour. So that medication that they give you pumps through. It goes through very slowly over an hour. And then they go to see what percentage of that has made it through. So after they do some calculations, you get a report showing the percentage of how well your gallbladder is working. So that test showed that my gallbladder was working at like a medium level. However, I was on medication to help the functioning of my gallbladder, which they probably should have had me stop before they did the scan. But they said with that number wasn't a good number, with the fact that I was already on medication to help my gallbladder. So they could tell that it just wasn't quite functioning correctly. And like I said in my previous video, I've been having issues with my gallbladder for years, probably since 2018 around about. I've never had pain in my gallbladder, but I did have issues where it just wasn't releasing bile. So I would have a lot of episodes of extremely pale, like tan colored stool. And that's a sign of there being no bile in your stool. So your gallbladder isn't releasing bile. So my GI doctor back then in 2018 wanted to do a HIDA scan, but a lot of stuff was going on with my health back then, and that just wasn't a priority because it wasn't causing any pain. So now that I had it done, they could see that it wasn't quite functioning as well as it should, but they were more concerned that there must be some kind of blockage happening in my gallbladder, that like a stone or something that they just couldn't see, because clearly there was times where it wasn't functioning at all. So the fact that I'd have like once a day, bouts of it not letting out any bile at all, and the fact that it was so inflamed was concerning. But I think the biggest concern they were having is that it was causing enlargement and inflammation of my liver. And they didn't want it to result into an acute liver injury, or for me to even have a gallbladder attack. They were pretty shocked that with the numbers that it was showing, that I had not had a gallbladder attack yet. And I am very grateful, and I thank the Lord that I haven't had that yet. I don't want to know what that feels like. I do have pain in the gallbladder when they press it, like really press it. Like if I'm laying down and they press where the area is, it hurts. Now, I just assume if anybody's pushing on somebody's gallbladder, that hurts, but they said it shouldn't hurt. So that's the only time I really felt pain. But otherwise, I'm not really having pain from it. I'm just having the pale stools and lots of diarrhea, unfortunately. So what they were concerned about, like I said, is an acute liver injury, and also just me not needing an emergency gallbladder surgery because I have a severe attack out of nowhere. So I had the choice to either wait a little bit longer to have the surgery, like wait till some point next year, but then I was risking the possible acute liver injury or a severe gallbladder attack that would cause me to have an emergency surgery, or I could go ahead and do the surgery now and just have it removed because it needed to be removed. Like they let me know, like it needs to be removed. But because you're not having so much pain, and because what's happening right now isn't too severe, that, it was up to me if I wanted to do it now or wait. So the other thing also I didn't mention with the liver besides the enlargement was that, every time they've done liver blood work since the surgery, the numbers are getting higher and higher. So they're showing that there's more inflammation in my liver with every few weeks. It's getting worse and worse. And that's why they are concerned about the acute liver injury. So I decided that I'm going to go ahead and do my surgery now, because there's two reasons. One, I want to get it out of the way. I don't want something looming over me and just being here worried about like a sudden gallbladder attack. Like I don't want to be thinking that every little twinge or whatever that I feel or any other symptoms that I'm having must be the gallbladder about to like wig out on me. Like, I just don't want that concern or worry looming over me. And also the worry of, obsessively looking at my liver test every time they do blood work, wondering like when I'm going to reach the point of an acute liver injury, and what if it's even worse and my liver ends up having more damage than they can, quickly fix. And I just didn't want those things looming over me. Like I'm starting to feel better, I'm getting healthier, and I just didn't want something like that looming over me. Also, with the bariatric surgery that I just had in August, I did reach my insurance's max out of pocket and pay my deductible and all of that. So that would mean I'd be able to have this surgery without having to pay anything extra. So it's also a financial decision to have it done soon, just so that because my insurance next year is going to go up in price for the premium, and my deductible is going to go up, and my max out of pocket is going to go up a little bit as well. So I don't know how I will be able to pay for all of that again, especially if it's like a sudden emergency surgery. So between just not wanting this looming over my head and also just wanting to be able to make a good financial decision, I decided to go ahead and have it this month. So I will be having my gallbladder removed on Friday, December 22nd. And this should be a quick outpatient procedure. It's only about 45 minutes long. It's a very quick recovery. I recovered pretty well from my bariatric surgery. That first 24 hours was horrific. It was the worst pain I've ever been in my life, and I really struggled to fully wake up from the ketamine. But after that 24 hours, you wouldn't even have known I had a surgery. I was functioning completely normal. I was doing everything I needed to do. I was walking my dog. The only way that you would even know I had a surgery was the fact that I couldn't really eat or drink much. But other than that, my physical activity, my pain level, like it was fine. I had no pain at all, after that surgery. So I'm pretty sure with this surgery, I am going to talk with the anesthesiologist and talk about possibly not using ketamine this time if possible, and see if we can just do whatever the traditional anesthesia would be. I've always handled traditional anesthesia just fine. This last surgery was the first time I ever had ketamine, and clearly my system cannot handle ketamine. So I'll talk with them about that and see what my options are, especially because this is an outpatient procedure. So I will, after a certain period of time, be sent home, and I don't want to be groggy and unable to walk my dog and unable to really function once I get home. So if we could do just the traditional anesthesia, I know myself, and I'm usually able to completely wake up and be totally fine from traditional anesthesia within like 6 to 10 hours of having the surgery. And so that's very different than the 24 hours before I was fully awake after my last surgery when they used ketamine. So I will see what the options are. The other upside of this surgery is I will be able to be given pain medication. So I'm not going to just have to deal with the pain of they do have to put the air in your abdomen for the surgery as well, but not as much. And they will give pain medication to help manage that. And then they will send me home with pain medication. So I don't think I'll probably need it, but maybe I will for that day, just the day of the surgery. But the good thing about this is I don't need anybody to come in from out of town because it's not a long recovery. I will just have a family member or a close friend be there for me on the day of the surgery, and then I should be absolutely fine. Now, this is very close to Christmas, but I'm not concerned about any of that because I know I'm going to recover pretty well from this surgery. And if I don't, it's not a big deal. I'm staying in town for Christmas. All of my family lives within, 5 to 10 minutes away from where I live. So it's not going to be, too much to go to someone else's house for Christmas. And I'm not really worried about missing out on any Christmas foods, which I think by that time I should be able to still start eating somewhat normal. I mean, it will be a trial and error of getting to know what my body does and doesn't want to process well after having my gallbladder removed. And I will be taking it easy and, do my research on how I should reintroduce food, which will be nothing like after the bariatric surgery. But I'm not concerned. If there's anything that is offered during Christmas that I really, really want, but I can't have at the time, I'm totally fine with freezing it, like just getting a portion, freezing it, and eating it when my body is ready. That's one thing I do definitely extremely appreciate about having this surgery, is that a lot of the desperation and scarcity, like thoughts that I would have about food that led to binge eating in the past has let up, and that's very helpful. One, just knowing that there's only so much food I can fit in my stomach and that it's ridiculous to overthink that. And two, also knowing that there are a lot of things that my stomach just doesn't like anymore, and that I have to accept that there's just certain foods that aren't my thing anymore, even though they are things I used to love. Interestingly enough, the thing that I can never get enough of, even after, like, I loved this before the surgery, but it was my favorite thing during the pureed stage. And to this day, I make it like every other week, which is tortilla soup. I've always loved tortilla soup, but it is definitely something I absolutely love still and eat all the time. So I kind of always make sure I have some, rather there's some frozen in my freezer or I make some fresh. It is my favorite thing still. So I'll make sure I make some right before the surgery to have it frozen in portions, because I know that's just something that my body just handles well. We'll see how it does after the gallbladder surgery. It's not high fat in any way, but it does have a generous amount of olive oil in it. So we'll see how my body processes certain oils at that point. But otherwise, I think that it'll be a simple surgery. It should go pretty well. I'm actually seeing a new surgeon for this. My bariatric doctor is able to do this surgery, and I do know that my bariatric clinic wanted me to have any future abdominal surgeries done by them since they're more familiar with my surgery. However, because I didn't have the best experience with that surgeon, where they weren't, they promised me and the other patients during our orientations that if the pain was unmanageable after surgery, that we would be given pain medication, and that wasn't true. So that made me lose a lot of faith in them. In addition to that, I was very disappointed in reading my surgical notes for the surgery. I could see that my surgeon just copy and pasted generic surgery notes that he puts on every single person's surgery. There was nothing about my surgical notes that showed that the notes had anything to do with me. I knew I had certain anatomy things going on that should have been commented on during the surgery that weren't. One of the main ones being that I had a hiatal hernia, and that although they did separate that part of my stomach from the new stomach that food is going through now, the fact that it wasn't even commented on that I had the hiatal hernia was concerning to me, and that made me realize that the notes didn't have anything to do with like me personally, that they were just the general notes of what's done during that surgery. In addition to that, my GI doctor said that I had the early symptoms of fatty liver disease, and I had to have had that for a while, like a couple years or years possibly. And that wasn't commented on during my surgery either. And they manipulate your liver a lot for that surgery. And the fact that the fatty liver disease wasn't even commented on showed that nothing that was seen or done about me personally in that surgery was added to my notes. And that made me feel like I couldn't quite trust the doctor with a future surgery. So the doctor that I saw was about 35-40 minutes away from where I currently live. And I'm assuming that's a part of my hospital system that I'm a part of here in North Carolina. I'm assuming that they just needed more patients in that location, or that I'm not really sure why they referred me there, but they kind of gave me the impression that there just weren't any openings in the city that I lived in. However, I don't think that was true, and they were giving me a hard time when I asked about getting switched to my city, so I just stuck with where I was because I thought that was the only way I was going to get the surgery in a timely manner. However, the current surgeon that I'm seeing is also a bariatric surgeon, but in my city and in the hospital that's only 10 minutes away from where I live, if 10 minutes. And my family's a lot closer in case of an emergency, and my friends and the people who will usually be there to take me to the surgery are only a few minutes away from this hospital as well. And then if there's any complications, the emergency room is only a few minutes away from where I live, where when I had the complication after the bariatric surgery, I had to drive that 30-40 minutes away. So, and I also have a relative that works at the hospital system that's here in my city. So all of that just makes it a better option. And this surgeon, he was telling me he could get me in for this surgery. So I was told that I needed the surgery on Friday, December 1st. And he was telling me that he could get me in as soon as like 5 to 7 days for the surgery. And I was like, no, I need to make arrangements to make sure I have somebody, who's going to be able to be there to take me to the surgery and stay there for the surgery, hear what the surgeon says, how it went, and then bring me home, and I need to make arrangements for that. So I decided, since I'm going to be off of work on Christmas Eve and Christmas Day as well, and possibly the 26th, I have to check and see exactly what days I'm off, it would be better just to have the surgery the weekend before Christmas, so that I'm not needing to miss anything more than just one day of work outside of the regular scheduled days off for the holiday. So I decided to push it till December 22nd, just to make things more convenient for work. Also, I work in health insurance, and it is currently open enrollment, and I didn't want to have the surgery anytime before the 15th of December, when open enrollment ends, because we are extremely busy at work, and I knew that I wouldn't be able to catch up. If I had to take any time off, there's no way I'd be able to catch up by the 15th. So I decided, let's go ahead and do it after open enrollment ends. In addition to the doctor coming out after the surgery to give you information, another thing that kind of made me lose faith in my surgeon who did the bariatric surgery was that, my sister was there, for the surgery. And when the surgeon came out to tell her that the surgery was done, she asked him, like, hey, how did the surgery go? She wanted details so that she could know what to tell me. And he wouldn't give her any details. I don't know if he was treating her like she just wasn't smart enough to understand anything, or if I don't know what his reason was, but he just told her, like, she did great, the surgery's over, everything went fine. That's all he would say. He didn't say, like, hey, that we saw this, we noticed this, we tried this, or like that took a little longer for this, or no detail whatsoever. Just like my notes and I've had, like I said, I've had many surgeries, and never have I had the surgeon not come out and say something. It's like something about that person that lets you know that they're talking about their surgery. No details whatsoever. And so that might just be the way this surgeon does things, is keeps things very impersonal. But I don't like that, because my body has a lot of things going on with it, and some unique issues and problems, and I need to trust that the surgeon that I'm seeing is going to be aware of and pay attention to those things. So I did mention this to my current surgeon and let him know that that was a concern of mine, and that I'm hoping that he's a little bit more personal, even though this is a shorter, simpler surgery. They're supposed, in the process, he let me know that they will be investigating and checking all of the ducts and tubes that lead to the gallbladder to see if they can find the root of the problem, because what they need to be sure of is that my gallbladder, or that my liver, is going to be properly producing bile without the gallbladder. So they have to do some x-rays of things and some little checks before they close me up, to make sure that it looks like everything else with the liver is going to be working well and producing the bile, still producing some bile, so that I'll be able to function okay. So yeah, so that's the update. I am having my gallbladder removed, another abdominal surgery, only 4 months after the last surgery, which is a very scary thought, and not something that I truly wanted to be doing so soon. I'm still a little traumatized from the level of pain I experienced from the bariatric surgery, but this surgery is gonna have to happen eventually anyway, and I do kind of just want to get it out of the way. And since I am gonna have it done with a bariatric surgeon who's very familiar with the surgery that I just recently had, and has done surgeries shortly after that surgery as well, and is very aware of the type of scar tissue and things like that I'll be having, I feel confident that he'll do a great job, and that this will be a great recovery and a quick recovery, and I can just put it behind me. So start the new year. Let's hope that I can go many years without any other surgeries. But being spoony and having, chronic illness issues, I know that that's just not really how it goes, but I can always have hope and faith that I will have a wonderful 2024 with no surgeries. But it is what it is, I'm just grateful that I have health insurance, and I'm able to have, my health care taken care of, because I have gone through times where I did not have that kind of coverage and ability to have things done and taken care of. And just grateful that the bariatric surgery has worked, and the weight loss is happening, and that I'm getting better, and my life is changing, and, I could really see a better future for myself. So I'd love to hear from any of you who've had gallbladder surgery before, rather it's with the bariatric surgery or not. I don't know how common it is for your gallbladder to start failing this quickly after surgery. I know a lot of people end up having the surgery like a year after. Like you're very likely to have gallbladder issues after bariatric surgery, because any kind of rapid weight loss, rather it's from bariatric surgery or through help with medication or just through the regular way of working out and eating well, if you lose weight rapidly, you're very likely to end up getting some kind of issue with your gallbladder, which is why my bariatric clinic put me on that gallbladder medication to avoid it. But I think my issue was that I already had gallbladder issues, so this rapid weight loss just kind of like, pushed it over the edge. I wish they would have asked me a little bit more about some of my previous gallbladder issues. They didn't really ask me anything about it. Maybe I could have had my gallbladder removed with that surgery. I know that it's not something they do as often anymore, but it would just be really nice not to have two surgeries so close to it themselves. But it is what it is. And like I said, I'm just grateful that I'm not experiencing pain and that I don't need an emergency surgery and that things haven't reached an acute level. But yeah, so if you've had your gallbladder removed, please comment on this video. Let me know how that surgery went for you. If you had bariatric surgery previously and had to have your gallbladder removed, I'd love to hear like how you found out that you were going to need that removed and how much time between your gallbladder surgery and your actual bariatric surgery passed. I'm just curious how often this happens for people to need it to be done so quickly. My surgeon said that he's done it quite a few times. He's a younger guy, so I think it's a little bit more common than people probably realize. But also, like I said, back in the day, like probably 5 to 10 years ago, they used to just remove the gallbladder when you did the bariatric surgery because of the high probability that you're going to have to get it removed after anyway, just to avoid it. So, maybe that's something they'll consider again, because it could have avoided another surgery so quick, which isn't, the best thing. But anyway, I hope you all have a Merry Christmas and Happy Holidays and a Happy New Year. I will do my best to document some portion of my gallbladder removal surgery, let you guys know how it goes. And thank you again for joining me on this journey. And I hope you guys have a good one. All right. Bye.